Hello everybody, today we are going to discuss about the pelvic bone. This is pelvic bone, this is called pelvic bone, this is flat bone and irregular bone, and it has got three parts. This is called ilium, this is called pubis, and this one is called ischium. Ilium consists of the upper part. It has got upper end, lower end. Lower end is stressed as the 2/5 of the acetabulum, and meeting point of the upper end is midpoint. Above this is ilium, and below this is ischium. And ilium consists of the upper end, lower end, anterior border, and posterior border, and medial border. This is called medial border. This is medial border, and it has got three surface: iliac fossa. This is called sacropelvic surface, and posteriorly gluteal surface. Superiorly, this is called iliac crest. This is convexo-concave. Anteriorly, this is convex outward, and posteriorly, this is concave outward. And that much. And let's come to ischium. On ischium, we have got ischium, pelvic surface, dorsal surface, and posterior surface, and inferior ramus. The inferior ramus of the ischium joins with the inferior ramus of the pubic and form a conjoint ischiopubic ramus. It has got ischial spine and ischial tuberosity, and on the pubis it has got pelvic surface, anterior surface, and symphysial surface, and superior ramus and inferior ramus, and this is called medial border of the ilium. It continues as the arcuate line, iliopubic eminence, and pectinate line, and in the pubis this is called obturator foramen. Now let's talk about the anatomical points. While welding, we have to put the point between the thumb and the index finger in this greater sciatic notch. This is called greater sciatic notch. We have to put this in this here, and like this. The anterior superior iliac spine and the pubic tubercle lies on same coronal plane, like this, same coronal plane, and the ischial spine and the pubic tubercle lies on same horizontal plane, like this, and the pelvic surface should face upward and backward. This is anatomical points, and this is irregular points. It articulates with another pelvic bone from here and forms all the pelvis. And on the acetabulum, the head of the femur, it is attached to the acetabulum. And about the pelvic ilium, that is the iliac fossa, triangular area, bounded superior by superior end, anterior by anterior border, posterior by medial border. The attachment of the upper two-third, that is attachment of the iliacus muscle, and below there is the fossa, and this is called sacropelvic surface. Superiorly there is iliac tuberosity, auricular surface, pelvic surface. On sacro and iliac tuberosity, there is the attachment of the dorsal interosseous ligament, sacroiliac ligaments, and the lumboiliac ligaments. The auricular surface articulates with the auricular surface of the sacrum. On the pelvic surface, there is the attachment of the obturator internus muscles. On coming to the gluteal surface, there is the posterior gluteal line, anterior gluteal line, which lies from the point from the greater sciatic notch to the anterior of the tubercle. This is called iliac tubercle, and the inferior gluteal line as inferiorly, and the attachment between the posterior border and the posterior gluteal line is gluteus maximus. The attachment between the posterior gluteal line and the anterior gluteal line is gluteus medius, and attachment of the attachment of the from anterior gluteal line and inferior gluteal line, there is attachment of the gluteus minimus muscle, and inferior to the inferior gluteal line there is a attachment of the reflected head of the rectus femoris. The straight head of the rectus femoris is attached to the anterior inferior iliac spine, and to the anterior superior iliac spine there is the attachment of the sartorius muscle and the anterior lateral end of the inguinal ligament. And on the iliac crest, anteriorly there is attachment of sartorius muscle, internally there is attachment of the internal oblique muscle, and outer lip there is attachment of the external oblique muscle, transverse abdominis, latissimus dorsi, quadrator labrum muscles, and erector spine as well. On coming to the ischium, the ischial fossa, this is called ischial spine, and this is called ischial tuberosity. On the ischial spine there is the attachment of the sacrospinous ligament. On the ischial tuberosity there is the origin of the hamstring muscle. 4 muscles they are semimembranous, semitendinous, biceps femoris, and adductor magnus muscle. 4 muscles. Thank you.